As healthcare moves towards value-based care, it becomes increasingly apparent that patient care is needed not just inside the doctor's office, but that the patient has needs outside of that setting as well. The chronic care management program is one way to address those requirements while supporting practices who are trying to provide top-notch value-based care through population health. Here to speak with me about his practice's experiences with chronic care management is Matt Cady from Adult Medicine of Lake County. Matt, thanks so much for taking your time here to speak with us. So tell us about the chronic care management program and what that has meant for your practice.
As we've talked about, I had taken over the practice about a year ago. And one of our first goals in embracing the population health is we knew we had to expand the care past these four walls, past that 15-minute encounter. And the CCM program is a vehicle to do that. That's very easy. In fact, I believe most practices are probably already doing it. They're just not billing for it. So upon taking over the practice, what we realized is that our referral team was spending a lot of time coordinating referrals for some of our most chronically ill patients with these chronic conditions, spending time on the phone with both the patient and the other provider's office to make sure that appointment happened just the way it had to. So at that point in time, all we did was just launch the CCM module. We then had our clinical staff help with some care plans, and relatively quickly, we had a very comprehensive CCM program, and it was our first step in expanding care beyond these four walls.
Paint the picture of what was going on in the practice before you got started with chronic care management. Was this, at least with the tools in eClinicalWorks, was this even on the radar for the practice? And what was the state of the organization when you got started?
The practice was in an ACO and a lot of the value-based contracts, and was probably underperforming. And the reasons were many, but we found the biggest initiative to attack that was, again, expanding care beyond these four walls. And by having our CCM team be able to talk to a patient at their time, on their terms, at their convenience, has made a huge impact. We're able to learn so much more about the patient and the barriers that stand in their way, and we're able to address those outside of the 15-minute appointment. I do think that it then makes the 15-minute appointment when they do come in for the office visit that much more impactful, because the patient is not forced to feel they need to tell us everything that's happened since the last one, because we've already documented it through these CCM calls and encounters since that last appointment. So when they come in, it's a much more valuable conversation. It dives into much more of the conditions much quicker because we've already accumulated so much data in between visits. That also goes with the specialists too. We found a lot of our older population was having a hard time coordinating appointments and just making it happen. My CCM team ensures that appointment happens and then follows up after the appointment to make sure we're all on the same page. So compliance has gone up and patient satisfaction has skyrocketed.
So with coordination of care between your office and the specialists, is this just a matter of the CCM coordinator just ordering a referral and faxing that over to the other office, or are they getting on the phone with that specialist's office, arranging for the appointment? How far does this go for you guys?
They're on the phone. What we found with so many new health plans being introduced right now, that we had a little bit of trouble making sure that that patient knew it was accepted at the other referral. And so my coordinator will make sure that it's done. There may be transportation concerns, there may be co-payment concerns, but my CCM coordinator is able to flesh out all of those concerns before the appointment to make sure the appointment happens and happens like we wanted it to.
Beginning a new initiative can be very nerve-wracking for a practice. They might not think that they have enough resources. They might think that it's a difficult process to even just get the technology in place. How easy is it to get started with chronic care management, both in eClinicalWorks and as a practice?
Well, starting with eClinicalWorks, it actually probably couldn't be easier. It's just a simple click of a button under product activation, and then the famous eClinical log out, log back in, and then it appears in the right-hand panel and it's ready to go. Almost immediately upon activating it, you'll be assigned a product implementation specialist who can reach out to you, go over concerns and the reports and the robust dashboard. So from an eClinical perspective, it's very, very easy to do. From a practice perspective, it would almost be as easy to do because we found that most practices are already doing CCM. They're just not documenting and billing for CCM. So upon having it in the right-hand panel, any staff member is able to click time and bill time against that patient as a coordinator.
Clinical staff, right?
Clinical staff. Any clinical staff is actually able to book time against that patient, and they're spending that time anyway. They're on the phone with the patient explaining a medication. They're on the phone making sure they understood the need for the referral. So they're doing it anyway. I just find a lot of practices aren't taking the time to document it through the intimidation. Using the product implementation specialist and the activities a practice is already doing, it's probably one of the easier programs to implement.
How scalable is chronic care management from your perspective?
That was probably, we actually had explored a couple CCM options when I had first started and selected eClinical for mostly that reason. It's incredibly scalable. We were able to go from none to 40 to 200 to 800 with just the amount of adding staff. And the staff I'm adding is only in my care management team. I've not had to increase my billing team, my administrative, or any compliance costs because it's all within eClinicalWorks. So it's been relatively easy. Everything is tracked within eClinical, from my consents to my billable time to what's been claimed. So it's very, very easy and very scalable. Again, we went from 0 to 40 to 200 to 800 in about a 10-month period.
What about that process of taking the time that you're tracking, because you mentioned that your staff can collect that time, translating that into a claim? What's that process like?
I think last month we probably dropped in the high 600 claims, and it took probably 13 minutes. And the beauty of it is eClinical is able to look at the time that's been documented. It suggests the code relative to the time. I simply go through, review the claims and the proposed claim or the proposed codes. If I agree with them, I click run. And then within an hour, my billing team sees these claims, is ready to submit in their billing team. So again, we went from 0 to 40, 200 to 800 patients, and my billing staff hasn't changed at all.
Now, you mentioned that as you scaled that up, really the only change to your staffing was additional coordinators. Mm-hmm. You said that you started out with your existing referral coordinator who was already doing much of that, maybe just changed her role a little bit. At what point do you need to start bringing somebody on? In other words, how many patients do you usually have per coordinator in your office?
Okay, there's a couple different numbers that we could explore. One of the first ones is we found that around the 75 mark becomes, you can justify a full-time job. At about 75 completed claims, when you do the math on it, you can justify a full-time job. At about 100 and just over 100, it becomes its own little profit center. On average, most of my people will manage just over 200 patients and will generate just over about 100 to 150 claims a month of completed calls. Right now, we currently have 6, and we look forward to adding more to that team. The numbers, I would say, it's probably practice-driven. As you see the need, what we did is at the 75 member, we then hired somebody, became a full-time position. As we then ramped up again and hit somewhere in the 65 mark, we hired another person, transition, and we've ramped up, hired, and then moved those patients to that person. And it's been relatively seamless.
How has participation in the chronic care management improved patient care, and where do you see the impacts of that program?
Probably out of everything we've done this year is probably the biggest impact on patient care and also patient satisfaction. I'll do the patient satisfaction first. We, on a daily basis, will have feedback from the exam room at the provider level of how much they enjoyed having the CCM coordinator be a part of their care circle. It happens on a daily basis. The ability that the patient has a name and a phone number to someone that can answer, that knows their name, that understands their condition, and is that inside of our office has been huge for them. Absolutely huge. From a patient outcome perspective, we've seen it in a couple different ways. We've seen a much higher compliance with referrals because we were able to remove any barriers that were standing in the way, whether it be transportation, co-pays, conflicting schedules. We've had other practices not call our patients, and where our CCM coordinator uncovered that they hadn't been reached out, and we made sure they got the appointment they need. We've also had a much higher compliance with medications. We were able to explain to the patient why they were assigned a new medication, why that medication is important. We were able to find out maybe they were unable to refill that medication, in which case we could work with them on getting it refilled. So it definitely gave us much more insight to what the patient's going through on the journey to getting them to a better health.
What does that interaction between the coordinator and the patient look like? Is there a script that they follow? You know, how do you spend that upwards of 20 minutes of time or more each month with the patient?
So we set out to not make it feel formal. We figure every other interaction with our office here is a very formal, structured one. So we actually don't give our CCM coordinators a script at all. We also hire them with a strong clinical background, but with the right personality. Because really, at the end of the day, what I'm looking for is a connection with their CCM coordinator. So that way, if there is a concern from either the patient or a caregiver, they feel very comfortable reaching out to our CCM coordinator. We've even found that some of them have become so attached that when they come through, they'll ask to say hi to their coordinator. We have a couple of patients that have even brought friends by to meet their coordinator. In a prior podcast, we had talked about that we have a exam room set up as a dining room to have a nice conversation. And a lot of times we'll bring the care coordinator into that conversation with the family because she's worked with the family over the last couple months on anything from advanced directives to a new diagnosis to dad or mom. And it definitely makes the patient feel much more a part of this practice.
What are some specific examples where chronic care management has made a difference for patients?
Specifically, I can think of, we were able to identify one of our highest reasons for admittance was congestive heart failure. And the problem we were having is that we didn't have the way to monitor the patient in between visits. So any retaining of water, gaining of weight, loss of weight, we were flying blind. At best we could hope that the patient had an appointment every 30 days and we could capture as much of it there. With having access to CCM and having my care coordinators talk to not only the patient, but any caregiver at the house, we were able to identify these people retaining water much earlier on in the scenario. As such, we came up with a program where they were able to utilize our walk-in clinic instead of utilizing the ER. And in the last 6 months, we believe that 100% of these people would have gone to the ER at some point in time, potentially once it had become severe. In constant contact with these patients, we're able to find out as soon as we've gained 1 or 2 pounds, not 8 to 12 pounds. And at that point, we're able to bring them into either our office or our walk-in clinic and address it right then before it becomes a life-changing incident.
And you've actually implemented a special program in that walk-in clinic to address that issue. What strategy are you guys using?
So what we've done is we've partnered up with a home health company and one of our main cardiology referral sources. And the reason being is we feel that the patient needs constant contact. So with home health being there either every day or every other day and my care coordinator filling in those gaps, the patient is almost constantly in contact with somebody. And on the days that they're not, the other two teams are talking. So my care coordinator is talking to the home health, who's talking to the cardiologist. So whether it's my caregiver or the home health, once they identify that we have retained a couple pounds, the decision's made right then and there. Is this going to go to the ER? Is it going to go to our walk-in? And we've said, again, we assumed 100% of these patients would have gone to the ER before. Now about 30% of them go to the ER. The other 70% we're able to treat in office before it becomes severe, leading in A, better patient satisfaction because nobody looked forward to going to the hospital, and B, a massive cost savings. So it's turned out not only better for the patient, but also for the practice.
Well, it sounds like a significant reduction in negative outcomes there for the patients, potentially negative outcomes for the patients, and also at the same time increasing the relationship, the amount of contact that you get with those patients in the office. Hopefully we get to hear more about the impacts that this has had for your practice, and keep up the great work. Thank you so much. If you'd like to learn more about the chronic care management program, you can check out my.eClinicalWorks.com or speak with your strategic account manager. And don't forget to check out our other podcast episodes on iTunes, YouTube, and my.eClinicalWorks.com. For the eClinicalWorks podcast, I'm Adam Solati. Thanks for watching.